Slacktail Squad, assemble.
That's right up there with airplane bathrooms. Wait, you should have said that again. That would have been a good on-air question.
You're just asking if we use toilets at porta potties or porta potties.
Yeah. I will only use that if it's a complete urgent matter. Definitely not for a poop.
Oh yeah.
If you can't hover, you can't use it.
You can't even hover if you want to poop because it could totally splash up.
Yeah,
if it hits with too much force, that water could splash right up on your legs. And
you got everybody's poop on you.
That is the water of 1,000 shits. And that would be disgusting. That is disgusting.
That's nasty.
The better question is, if you have to go in a porta potty, do you look inside the porta potty? Do you look down into the hole to see what it's like down there?
I do, because I'm not going to go if it's too full. I'll hold it. I'll walk right back out.
Tromondae.
I feel like if you walk in there, like you kind of want to see what's in the bottom of it.
But don't most of them have a urinal for guys? So
a
you
urinal?
don't have to.
Not all of them.
Urinal.
Yeah. So I mean,
a urinal.
I feel like urinals should be a part of homes.
Yeah.
So should bidets.
Yes.
I love me a bidet. The Swan thinks it's disgusting. I love the bidet.
I don't like
that
it.
Nice warm water splashing on me anus.
I realize it's like clean water and all, but you still have to wipe your butt with that.
It's so nice. So very nice. I mean, once it's
That's
stimulated.
why detachable shower heads are nice.
So you can go right up in there.
Right downtown. Yeah, go right downtown.
Sometimes you get disconnected and you walk right into something, you have no idea what's going on.
We were just asking if you have to go to porta potty, Ron's
does.
Do you sit down if you have to shit, or would you even shit in a porta potty?
Oh, I would.
Okay,
I told you would.
Do you sit?
Yeah.
Do you sit? He doesn't. He's just being funny.
No, I actually use one. Why?
Now, what about the splashback?
Do you put
what about
paper
the
down
splashback factor? What about
on
the
the seat?
splashback?
It's so far deep, there is no splashback.
No, that's not true. Tis not true. Tis not true. If you've been to a function where there's lots of people,
Tromondae's face.
Well,
there can be sometimes, and then if it tips over, you're at risk of being attacked by a cornback rattler.
First of all, where are you going that they tip you over in a, porta potty?
It's a prank. You've never pranked anybody?
Not in a porta potty.
We used to do it when I was on a flight crew. We used to fly out in the middle of nowhere, and they would flare the helicopters, and the wind would knock the porta potty over. It was pretty funny.
Well, yeah, that's one thing.
In there.
But wow, no, I mean,
we made sure there was nobody in there. It was just kind of funny.
Oh, okay. Well, that's the other thing.
So if you have
totally
to poop,
cruel
Ron,
to do to somebody in there.
You've pooped in a porta potty. Do you put toilet paper down on the seat, or you just put your bare ass cheek on it?
Put my bare ass cheek down. Just go for it.
Ew.
What?
I don't even like to touch the toilet paper in the porta potty.
And I don't wipe with the first.
What was the last hand?
Unroll.
Oh yeah, I unroll
several.
I unroll a bunch.
Yep.
Exactly.
Honestly, if you gotta go, you gotta go. And if if your standards are so high, you should carry your, you should have your own golden throne with a golden bidet with air jets coming out to dry your hiney, right?
This is the Slaptail Squad, by the way. I'm the Beef Man.
Are we recording?
Yeah.
Yes.
Good.
We have been. Yeah.
Good.
Oh yes, we've been recording. I didn't bother to clap. I figure I can figure this one out. I'm the Beef Man, master of the universe, the great and powerful, and yeah, I don't sit to poo in a porta potty. Generally,
you
speaking.
can stand in poo. How do you poo? You poo in a porta potty?
Not generally. If the water is too high and there's too much stuff piled up in there, yours truly is not.
Pinch your cheeks.
I prefer. You know that I prefer to be outside pooping anyway, so I will gladly go find a place to poop outside.
Will you dig a hole?
Yes, of course.
How deep is your hole?
Surface pooping is not appropriate.
How deep is your hole?
None of your business.
How deep is your
How deep
hole,
is your
Hans?
hole? How deep is your hole?
Well, since I use a porta potty, you look down and it's like, okay, there's sufficient room. However, if you're going out there, out in the
I've
woods,
seen it piled almost all the way to the top.
I don't know what festivals you're going to. So,
These weren't at festivals. Just
wow.
But I have seen it piled pretty high.
This is all because of you, Tromondae. We got into this subject because you had to go poopies.
And with today, because he can't stop talking, is the Rons.
Oh,
Say hi, Rons.
Yeah,
My
I'm
number
not the
two.
one that brought this.
My number
O-A.
two, who
O-A.
likes to poo on top of poo and sit.
Jesus. Yeah,
porta
this is
potty.
one of those podcasts.
We're gonna sanitize Ron's before next time we see him.
Well, I
We have to
appreciate
go
it.
through a hazmat tent.
You know,
where he can
delouse
come
him.
in.
the B-Man and I have been both in the military. You go where you have to go. Sometimes.
Oh, listen to this guy. Listen to this guy. You were in the Air Force. You were
They have
shitting
great
on
toilets.
golden toilets and had somebody else wipe your ass when you were done.
Well, yeah, I mean, isn't that the way? Oh, the Army doesn't do that, do they? I apologize. Right, I should have known that.
No, when you're living
Where
outside
do you
for
get
weeks at
this
a
idea
time,
from?
we're living outside for weeks at a time. Do you think I was going? Do you think we had porta potties?
Well,
You're funny.
You probably had crusty butt cheeks from your stuff. being
Usually you bring
all-
baby wipes with you.
wow.
Yeah.
So the Army's gotten soft. That's cool. Baby wipes. What do you get like with aloe or something like that to make sure your butt cheeks are soft?
Yeah.
I love
Yeah.
Tromondae's look. He just went, yeah.
We
I
are
mean,
animals.
no one wants some raw butt
Yeah.
cheeks.
What are you nuts?
And if
I
you
want that
ever
either.
noticed in the village people, the Air Force is represented. It's the Army guy. So, you got to.
There's no Army guy in. What are you talking about?
Oh, you've never seen the village people?
He's from the Navy, isn't
It's
he?
Navy.
Mm.
The other
There's
village
no-
people.
there's
There's
no
a
Army guy in the
construction
village.
guy.
There's a
There's
biker.
the Navy guy.
And then there's one
yeah,
who's inappropriately dressed like a Native American. So
Yeah.
what are you talking about?
Moving on.
Ooh, I think that he was saying that he was wrong.
Yeah,
Uh-huh.
okay, I'm wrong.
Also with us is the not great or powerful Swan. Say hello, Swan.
Oh,
Hello,
I
Swan.
think she's great and
That's
powerful.
that's not cool. I'm both. I'm all of it.
And of course, rounding us out. Hopefully he's washing his hands.
Because he's got the poopies.
He's got the boobies. It's the sexual chocolate from the wrong end. Tromondae.
Way to go.
Good evening,
Oh.
ladies and gentlemen.
How's your booty hole?
It feels okay right now. I've been using wipes.
With aloe?
Don't flush them.
No,
Not
yeah,
flushing
no,
those,
don't
right?
flush them.
Don't flush those.
No.
That would create a whole another set of problems for the poopies.
Yeah. Ron, I really can't believe that you go
I can.
shit in
Poopy?
porta potties.
I can believe it.
I totally
Why?
knew he was going to say yes to that
Why
one.
would I lie about that? If I got to go, I got to go. I mean,
There's so many germs in there.
there's germs everywhere you go in this
Poo
world,
germs.
right?
Poo germs.
There's germs
Poo
everywhere,
germs.
right?
Yeah, but I
Yeah,
don't
but
want to
you're
go
just
out of my
exposing
way
your-
to get them.
I don't want to go out of my way too, but it's either that or shit my pants. So one or the two.
I would take the two.
Right?
I should.
And you know what? Honestly,
I-
in this COVID society, this pandemic society, right? Some of the places were closed down where I knew where I could go. Like if I'm out, I could go into.
Mapped out. I go out for some. I make sure that when
my
I
shit
go out,
routes.
I make sure that when I go out, I know exactly where I can shit.
Well, you don't. I mean, you just go for the.
Those are
No,
important
they are
things.
important
Like
No, I
things,
don't. I don't plan my life around where I can possibly shit.
Well, I
Well, you
understand
don't
that
work-
too, but
you don't work in your car like Sparky does. I mean, she had to map out where she could shit out and about because or truckers or all that because that would suck. But
when I was out and about, it's like if you before the pandemic, you could walk into the bathroom of the store and use it. Some places I go to, shut it down.
No.
What? What do you mean no?
I'm not gonna buy
Like,
anything.
even before the pandemic, I didn't just go
Just gonna
shit
go.
in
Just
Meyer.
gonna go shit in here.
No.
Well, I'm not saying I mapped it out, but if I was actually out there sometimes and I had to go, I had to go.
Are you not saying that you mapped it out? Because it kind of sounds like you've mapped out where you can shit.
Well,
You've put a lot of thought into it.
I didn't put that much thought into it. I just knew where the bathrooms were in case I had to go. Right? It's just if I had to go and I couldn't hold it anymore, I went.
Doesn't your body have like a schedule? I mean, mine like tends to poop at home before I leave for work.
Yeah.
Same.
Or about 4 p.m. before I leave for home because then I get paid to shit.
That's great. Yeah, mine does
Yeah.
too. But sometimes, it doesn't always go to that
You feel
schedule.
the sudden urge.
I don't think
Diarrhea?
I've ever had a sudden
Diarrhea?
urge to use a golden throne with a bidet.
I
Yeah,
enjoy the bidet.
I don't.
I enjoy the bidet.
So how come the
I wish I
beaver
had a
does
bidet.
not have one at the beaver's den?
Because the Swan thinks they're gross.
I mean, you could get it for your own toilet.
I would love that.
That's fine.
Yeah,
I
you could
guess.
have it decked out in like gold.
I'll buy it for your next birthday present.
Right.
What if you just had somebody who would be in the bathroom and all you had to do was bend over and then they would spit water from their mouth
Whoa!
Is it warm?
at your rectum?
Is it warm?
Yes.
Well, it would come from their
Yes.
mouth, so it would be warm.
Yeah, but I mean,
They just
Is
sit
it-
there and they hold it in until you need it.
Okay, is it carbonated?
Is it spring water?
Is it carbonated
and
spring water?
how much
Is it-
water would you need to use?
Until it's clean.
to get it
Ron. Until it's clean.
Yeah, so I mean,
I mean, they could have one of those straw type things like that attached to their head, like that with clean filtered water, and then they just straw it in, spray it
wow,
out.
Tromondae, I thought I come up with some off the cuff stuff. That was one of
No,
those
they would have the beer hat.
Yeah, that's what I mean. Those
A
straw
beer hat.
things.
Yeah.
Those
Yeah.
straw things. It sounds like you mean they had a straw hat.
No.
Do you all think that men's restrooms are nastier than women's?
No.
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 Women's
Women are
restrooms are
disgusting.
nasty. Like frequently there's like poop on the back of the seat
They're
or
freaking
blood
nasty.
and
Yep, there's always
women are
blood. Yeah,
nasty.
they're fucking
And I don't
nasty.
know why people like need
Wow.
to flush tampons or they flush the freaking paper towel into the toilet. I'm like, why do you do that? You know that's not gonna go down.
And I know
Yeah,
this for a
women are
fact, not just
nasty.
because I've ever had to see a woman's restroom, but because I live with a woman who's a slob in the bathroom.
Hey, I
Pees.
am
I
not.
don't know how she pees
Wow.
underneath the toilet seat. I don't know
It
how does one
splashes.
get urinal? Okay, so lift it up and fucking look, and then clean it.
Ooh. Look at guys, you
And-
guys brought up a
and-
bad subject.
And she
right now.
doesn't fucking check the toilet after she shits to make sure her shit went down. So how much shit do I have to see? Or how
I was
about
just letting you
how about
make
when
sure
have-
that
how about when you have your period and drop blood all over the floor and you don't clean that up either?
that happens sometimes. It won't happen anymore.
Honestly,
Soon.
doesn't bother me one way or
Honestly.
another.
No, because you
Honestly.
shit in porta potties all the time.
Remind us not to eat anything that Ron's brings to the potluck. We don't want to eat Ron's potluck food.
You know,
What
the poopy head.
what
No, I
makes
do
you
not.
what's making you have the poopies today, Tromondae? Why do you have? Because this was supposed to be an in-person podcast, but it's remote because
It was.
Tromondae is in fear of having the poopies, as he calls it. As he
So
very
I-
maturely calls it. The poops or the poopies.
Yeah.
The poopies.
I had like a message like ready to send Justice Swan to say, hey, what can I take for the poopies? Because I don't want to send it to either of you.
Aw,
What do you
he
mean?
felt
But I-
the need to ask me.
Yes.
Aw.
But then I just said, I think I may just have to.
Imodium AD, I think, is one. Anything that's fibrous.
Sometimes you don't want
You're
to
not
stop
supposed
the
to stop
poopies.
it.
You let it run its course.
Oh, I agree,
because
but-
otherwise you're holding in stuff that needs to come out. It's coming
That's
out for a
good.
reason.
That's good to know. And I didn't
So
have that.
what
medication
caused
here
this?
either, so I don't know. Only thing I've eaten today was a tuna poke bowl.
What is that? Sounds like
Made
a
out
Pokemon
of tuna and
gone
Pokemon.
bad.
Tuna and Pokemon.
Tuna and Pokemon.
There you go.
All the bad
But it has, like,
Pokemon.
Some like purple rice
It's
and
purple rice?
avocado
You sure it was purple rice?
and like some ginger.
So you got this. This
And
wasn't
tuna,
at
of
school.
course.
This was like at a Asian restaurant.
No, like I ate it for lunch.
Did you get it at a gas station?
I don't eat gas station food. That's another thing I don't do. Like
Oh no, I wouldn't
places
eat
with
gas station
McDonald's
food
is
either.
attached to it. I'm not getting McDonald's out of here. I take it Ron probably does.
Yeah, you eat the hot dogs that roll around in the gas station
No.
Oh, I did.
window or the pizza from the gas station
I've
window.
eaten pizza from the gas station.
I've eaten hot dogs
No.
long ago from from a convenience store.
I don't think I've ever had a hot dog, but I know I've had pizza from gas stations.
No, not.
I still don't sit on the porta potty to take a shit though.
I just can't bring myself to do it.
No way.
Nope.
Hey, let me ask you guys this question. Let's pretend that I just met you. And I am teaching a class. It's an informal class. It's a class for your employment. Is it totally strange if all of a sudden just I start talking about all of my own medical conditions and how I take narcotics twice a day? How professional is that? Super professional? Would that be super professional of me?
Absolutely not.
It depends
No.
on what you're teaching.
Oh,
If this is an AA meeting, sure, I think it's appropriate. But no, I feel like if you're an instructor for a class, no matter what it is, I don't think you should divulge your personal life information and the fact that you're a prescription drug addict per se.
Well, you're saying drug addict. He didn't mention drug addict, and I'm thinking.
Okay, if you
No,
take
I'm thinking that.
prescription narcotics twice a day,
Well,
chronically, you're a drug
all right,
addict.
that's your opinion, but
By definition, by definition,
you are.
okay,
Whether it's
by
prescribed
definition,
or not,
but
by definition, you are.
however, if it relates to whatever you're teaching, right? Like, okay, we're going to go over the side effects of whatever. However, personal information dealing with that, that's kind of iffy. Sort of like when
if I'm
okay.
teaching it's not even teaching. If I'm presenting to you,
lecturing, right?
as in it's an employee, you're a new employee orientation, and it has nothing to do with that. And I divulge to you that I'm taking to the entire class that I'm on opioids twice a day because my doctor wouldn't give me pain medication when I hurt my back, but this other doctor would. Why do I need to know that?
Yeah, you don't. That person should not have divulged that information.
Would it be, and I'm looking it through something else, and hold on, don't tell me no, right? Don't tell me no. Would it be related
There will be times when this is totally appropriate.
Does it relate to anything in the conversation for
the job
lecture
itself,
that you're
right? So if you go,
No.
hey, I need you to lift 50 pounds,
No.
and you go, I can't, I'm on opioids for whatever reason.
No. You're not listening.
But
Probably I'm not.
Ron,
No, I'm not
Ron.
relating because I can't relate. So I'm trying to relate, but I guess I
Is it
can't.
because you don't work?
Ow.
Or
No, but
is-
he's.
I love
he
you,
said
Ron. I'm just
Okay.
He said he's the presenter.
Yeah.
Okay.
So
I didn't
he's
say
not.
it.
He's not a future employee asking about how does the health insurance work because you have to take this medication. I'm presenting this information to two new employees.
Yeah, in other words, this is the group facilitator who's already employed talking to the new employees, and it has nothing to do with the presentation.
Maybe he's looking for a hookup. I don't know. Maybe it's like, hey, do you have some of this stuff? Because this is what I need. I don't know. Right?
I think my point
Is
was
it
it's not
inappropriate?
just,
Could be.
it's not justified at all. It's not justified at all. No,
At all.
no, not in any way.
I mean, I don't. Who's taught classes around here? I mean, plenty of people have taught classes. Do you tell them your whole personal life? That's really no, not at all.
I do not.
I don't even tell them what I do for my job, and I'm doing it at my job. So,
well, just recently, and I'll throw this out, and I know I'm going to catch flack from the B-man on this. It's
going to have something to do with martial arts.
It is.
I was.
I was just
shocking.
Shocking. There we go. I was a TA for a day, right? So I came in. They said, "Can you tell yourself a little about yourself?" I said, "I teach martial arts. I hold 2 black belts in Okinawan karate and Okinawan weapons. And tell me something about yourself now, right?" But it's sort of like on that relatable. I teach.
So next you're like, I'm on opioid pain medication. Okay, next.
No.
But it's prescribed by my doctor, so it's okay.
But I on a teachable level, I said I teach this, or I coach this, and this is
I teach
this.
This.
Is how it is. And then and then I said, okay, tell me about yourself, but I just dropped it right there. So.
You didn't be like, check out my website, and this is when a Facebook friend requests me, and
No, I did. And
No.
it's like, if you
Okay,
ever meet
just checking.
Tromondae, he's really cool.
You know, the other thing that I hate is when people tell you that I broke this. And I'm like, oh, how long ago was that? I'm like, that was recently? No, I broke this 10 years ago. Okay, it's not still broken. Stop acting like it's still broken. That drives me crazy.
Like, I take these opioid pain medicines for my big toe fracture from 2012.
When you broke a board.
It literally, it was like that. It was years ago, and she's still on it. And I was like, one, I don't need to know that. Two, there's two people that are clinicians in this orientation that you're telling this to, and you're acting like you know something about medicine when you're a lay person. And saying it as if though we're going to agree with her. And I could tell by the look on the other lady's face, she was like, you're giving us too much information. None of us needs to know any of this. Because I could tell she was thinking the same thing in her head that I was thinking. I was like, lady, you don't need to be telling anybody any of this information whatsoever. That's not toilet paper, is it? You're not like prepping.
No,
he's getting all prepped. He's like,
wow.
Okay, just
just in case.
You know, honestly,
he needs to use the poopies.
No, I thought it looked like tissues, and I'm like, I don't know what he's watching on the other monitor. So, you know.
Funny that your mind goes there, but we went right straight to poop.
No, Ron, what are you?
I also want to know that
tissue, Ron.
Yeah, hey, it is.
If you have the poopies and you don't feel well, porn is on your mind.
Right.
Hans has got some weird fetishes. He's got a poop fetish.
Oh, no, I do not.
He watches porn
I want to know right now, though.
in the porta potty.
Are you even slightly nauseous right now?
No.
You're not nauseous at all right now?
No.
Does your stomach hurt at all?
No.
Okay, so you just have the poos. Or the feeling that you're going to have the poos.
Yeah.
That urge, I
don't feel sick.
That urge in the back of your head.
Abdominal cramping?
The B-man is trying to push your body mentally to go and run from the mic. So you can run to the bathroom.
Did you get like the cold sweats before you had to go? And like the severe abdominal cramping? And the urge, like you had to clench your cheeks so you weren't going to make it there.
I wish you total bowel evacuation. maybe you
just needed a good
you have
poop.
The piece of total bowel.
So you know what? This is their fetish, not mine. I'm just totally along for the ride right now.
I'm trying to transition.
But you're the one who brought it up.
I'm really trying to transition.
You started it,
but because Ron keeps talking, I cannot transition into.
Oh, yeah,
we are now 1 week post Swan's surgery.
Yay! Post Swan surgery. Swan's is feeling good. Yay.
So, Swan, would you like to tell us a little bit about your surgery?
Sure. So
do you have pictures?
I do have pictures. Wow. So for the last year or so, probably, I don't know, I've been having snore. I've been having a frequency of urination and some constipation and some
so you couldn't do the
bleeding.
Poopies.
Shut the fuck up, Rons. I couldn't do the poopies.
Rons.
Yeah, not the runs. So and then about, I don't know, maybe January or so, December, I started feeling my abdomen and I thought I had a hernia. So I had the beef man check it too. We weren't really sure. I made a doctor's appointment. My doctor couldn't feel it, even though I could palpate it and could feel something like the size of, I don't even know, what do you think? Like a softball, maybe?
Palpate.
Feeling?
Means just
palpate, touch, feel around, poke around, push on my belly area. Could feel it. It wasn't really painful, but it was sometimes.
Right,
so I went to my doctor.
Yep,
anyway, shut the fuck up. I'm going to start all over again if you don't shut up. Went to my doctor, who's, God bless him, he's a cute little old guy, but he might need to retire because he told me I need to put rubbers on before I touch anybody. I was a little bit crazy, but okay. He had to put his rubber gloves on before he touched me.
You know, this story's great, Swan, and I just like how you're cracking yourself up, but the rest of us aren't amused. So could you just tell the story?
Yeah,
no, I'm amused.
He couldn't feel it. So he ordered an ultrasound, pelvic ultrasound, and it turned out that I had uterine fibroids. So fibrous tumors.
Okay, first of all,
benign.
You're missing an important part of the story.
What am I? Okay, go ahead.
Your doctor had already told you that you had fibroids. He just said it wasn't very big.
Yeah, he thought it was about the size of a golf ball. My OB doctor. So we were just going to keep an eye on it.
Which means obstetrics and gynecology.
OB.
Lady.
So that was about 2 years ago. He said it was about the size of a golf ball. We'll keep an eye on it. Cool. Do something if we need to. But now I can feel it. It's hurting me, bothering me. Go to my doctor, get the ultrasound. Go to my OB doctor. He says, holy crap, that's a lot bigger than we thought it would be. It's measuring about 10 centimeters, which is the size of a baby's head when you give birth, folks. So
Wow.
bigger than a grapefruit. Needs to come out. So because of COVID, shit's fucked up and it took forever. So from February until now, been trying to get scheduled for my surgery. Had surgery last Thursday.
Wow.
Feeling pretty good. Yay.
Now,
But-
what
so what do we wanna hear about
exactly?
it?
Go ahead, Rons. Please ask your question.
Mm.
It's probably very important.
Yes.
Before the surgery, right?
Yes.
I had two
Right.
questions. One, how did the
Where do
bead man
babies come
probe for? Yeah, that was it. How did the bead man probe you to make sure that this was a grapefruit size? And we'll let that question pass. But two, as nurses in the field, was everything up to your standard walking in?
Walking into where?
Every step of the way, from
No.
the diagnosis all the way up to surgery, because you
So
guys get to see
the
behind
first
that.
question, you could physically see it when I laid down, like on my belly, like pouched up, like a bulge in my stomach. So either it was a hernia or something
Okay.
going on. So obviously it was that. You could see the outline of it, and when you felt it, it felt firm and like a
And it changed
tumor? I don't
size
know.
throughout the month.
Yeah.
No,
If
okay,
it was
okay.
like after my period, my belly would be pretty flat. About 2 weeks later, like during my ovulation period, it would get like when your uterine lining gets more fuller and your uterus gets bigger, you could see it and
Yeah,
feel
because
it.
the
even
uterus was
bigger.
pushing up. The uterus is pushing
Yeah.
out.
Okay.
Or Ronald, were you asking if they were pleased with the services they received?
No, because
Okay.
the bead man and the Swan are in the medical field. We both know this, and they go in there with certain high expectations, or certain expectations. We'll go there.
Well, I don't want to be fucking killed. That's for
So-
sure. I don't want any medical
No,
mistakes
I
made on me.
understand
So
that,
yes,
but
I go in there and make sure.
So like you're a counselor, and when you walk in, you have certain expectations, so you know the BS when you see it and when you hear it.
Right. So that's what I'm saying. Like, were they pleased with the services they received? Were the medical treatment that they received, the advice, the counsel, all of that was up to their standards?
Well, yeah.
So I like my doctor, my
Yeah.
OB doctor. Really, I've liked him. He's been my doctor for more than 15 years, so I trust his decisions. He told me everything that was going on, and he said it's pretty big. It's like there's 3 ways they can take this out, right? They can try, well, 4, I guess. They could try to like laser it and make it break up, kind of like they would do with kidney stones, and you like pass it out like through your vagina like a period. But that wouldn't work because it's too big, and they always come back most of the time after that anyway. They
Yours
can
wouldn't
try
have
to
worked
take it out.
anyway because you wouldn't have been able to pass it.
Right, because it was in the lining of my uterus. So it can't pass out that way anyway.
Was it?
I think so.
Not
One of
from the
them was, and one of
pictures.
them maybe not. I don't
Because
know.
okay.
That's what they thought. That's what it said on there. Intramural, intramural, yeah. But I think not. Now that you look at the pictures later coming back from it. But anyway, so they can
Are
take
you
it
able-
out laparoscopically, where they poke holes in you and they pull it out like through. But they go in there and then they pull it out through your vagina, or they can take it out vaginally only. Tromondae's face is good. Yes, this is what we're going for. Discuss the Tromondae. Or they can take it out like a C-section, where they cut you across your lower abdomen and take it out that way. And that's what I ended up having to have, because he told me, honestly, he said, we could try to take it out laparoscopically, but I don't feel like I can do it without having to go in. We can try it that way. Then it's going to take you 3 hours of surgery, and I'm going to end up cutting you open anyway. Then you're going to have poke hole surgery and the other surgery, which a lot of times the laparoscopic surgery is more painful because they fill you up with air and they poke around in several spots and it's through your belly button. So my scar is actually better being lower and bigger because I don't even see it because it's my underwear covered up. But anyway, so yeah, he explained it really well, I think. And he told me, which kind of made me scared, but yet also gave me comfort, that he was going to have his partner scrub in for my surgery with him partner. Yes, it was a female. It was another surgeon.
So when you
Who
say
her
partner,
specialty,
you actually mean his business partner.
work partner. Yes,
I'm so confused.
yes.
All these different
not
terms.
just his significant other partner who's not a surgeon at all.
I see.
Yeah, no. She's well qualified, and that was her specialty. She likes those kind of things, and because he was worried that there might be a complication, or because of its size, he wanted an extra set of hands that could do the surgery as well. And she ended up taking over and doing it. So
He sounds like a keeper.
yeah, I like him.
So
He used to be much cuter when he was younger for a doctor, but now he looks a little old. He shows his age. Just saying.
So you had full confidence walking in with everybody and everything.
No, with my doctor. Going to the hospital is a whole nother story. I mean, people, I don't even know, lay people, non-medical people, whatever, they just go in, they're like, yep, I'm gonna have surgery. They actually like look forward to that shit. Like the people that were checking in around me, like, oh yeah, just going in for my total knee replacement, no big deal. And like the one lady was a big fat elderly lady. I'm like, ooh, she's not a good surgical candidate, but looking forward to my surgery. Like nothing's gonna happen. They're gonna be fine. You know what I think the whole time? How many fucking ways am I going to die during surgery?
Yeah.
What are they going to screw up? Are they going to give me the wrong medicine? Is my nurse going to be crappy and not recognize if I'm doing bad after
what I alluded
surgery?
to earlier, is that from your practitioner as a nurse walking in?
Is that a word? From your practitioner?
Your practitioner. So
I mean, part of it's just I feel like common sense. I mean, I don't know. I'm not looking forward to having
but knowing
surgery.
knowing behind the scenes, right? Knowing how everything
knowing what they do to you while they're in there,
behind some sort of chinois, if you will.
Thank you,
I was not confident about that part of it. Not definitely. I was trying to play it off like I wasn't nervous or anything. I mean, I feel like I did a.
So you were saying that you were lacking some sort of level of confidismus.
Yeah, exactly. I mean, I felt like everything would be fine, but there's always the distinct possibility that you're going to be in there and you ain't going to wake up from that surgery.
So,
or
true. There'll be some level of deadness.
No,
I believe the word is deadness.
Walking in like that, you don't like cheerful people going in for surgery then?
Well, why would you be cheerful about going in to get your freaking
unless it was like this
done?
Unless it was like this penis lengthening, thickening surgery that actually enhanced sensation? That would be pretty. I'd be pretty stoked for that.
You'd be signing up for that one.
100% success rate.
Well,
I mean, and they tell you all the possibilities of what could go wrong.
And in some way, your prostate was stimulated at the same time.
So you not only had a good,
so not
you
only
had a nice orgasm with that.
Not only did you get length and girth once, not only would you get length and girth, and there would be no nerve damage but heightened nerve sensation, but there would also be stimulation of your prostate each time that you had intercourse. And it was 100% success rate. Yes, sign me up for that surgery. Thank you.
Well, wouldn't Peyronie's disease for surgery for Peyronie's disease fix that and actually do that?
No, and why are you all hung up on Peyronie's disease, dude? That just means scar tissue in the penile tissue.
Well, I was trying to seem smart for the beef man because you're always bringing up
miserably
medical conditions.
I don't think the surgery that I just proposed is an actual surgery.
I feel like that's just a made up figment of your. That's a figment of your imagination.
Okay, why don't you?
Once I'm all better and I can wear the nurse costume again, we'll do that surgery for you.
So basically, then Swan, you had to have your uterus or the baby bag, if you will, removed.
Yes. I tried to show it to the baby Swan. I mean, she lived there for 9 months, but she didn't want to see it.
But not only did you have the baby bag removed, but you had these fibroids removed also. And fibroids, or myomas, or the many different names that they're known by, are basically muscular and fibrous tissue tumors, is what you had removed.
Yes.
And you were thinking, and that after reading the description, I'm not sure that that's actually the case. You were thinking that these were like intramural or submucosa or whatever fibroids that were actually inside the uterus.
Yes, that's how that's what they thought. Like, so it was like in my uterus, yes, in the lining of it. So like it could be inside, like if you look at your uterus like a balloon, it could be inside the balloon.
Or a baby bag.
or a baby bag, yeah, where the baby lives, or outside the baby bag, just floating around next to your guts, but hanging on, attached on the outside,
Yeah.
or in the lining, which is what sheds when you have your menstrual period, which is where they thought that it was.
When you say
and they thought that there was
you
one.
don't mean us, because we don't have menstrual periods, Swan.
When me or any woman, female, or transgender man, female, transgender
I don't
female.
think you need to
right?
go down
They
that
would
route.
still
I
have-
think you can just
I just want to make sure I cover
say-
everybody.
I don't think that's
Covered everyone.
necessary. I don't think you have to do that. I think that
Born with the uterus. Anyone born with the uterus who has
well, I mean, you can be
menstrual
born with
periods.
there you go.
Who
No,
has menstrual
let's not get
periods.
too specific.
Okay.
You're
So anyway,
Tremondae,
they
this
thought there
is
was
really
only
cool.
one.
They do
They
get
thought
out.
it was about 10 centimeters big.
yeah,
so
yeah,
the
we got
size
that
of a
part.
baby
We got
head.
that part. What I want you to do is I want you to describe. Actually, I want to hear. I want.
Well, can I ask?
Ron's
You want
side.
to hear what they
hold
did to
on,
me for my
hold on.
surgery?
Did you get to keep it, like in a jar of
No,
formaldehyde
they
or
send
something?
it off to pathology so that they can make sure that it's not cancer.
Oh,
What
So,
I'm going to do is
yeah.
I'm going to read the surgical notes.
I have a picture of it. So do you want to read the surgical note first, or do you want me to tell you what happened to me?
No. You can do it as we go along. You can explain it.
Okay. Okay.
Should you need to. Now, I don't know if you know anything about female anatomy, Tromondae.
now
and,
why would you say
Ron's.
that? Why would you
Because
say
most
that?
You know how it works?
Is it because he's gay?
Most females,
You know he
because
has a
most
kid.
Tremondae has a baby.
Yeah, he has a kid.
I'm going to go with Tremondae's had more sex with females than you have, Ron.
You know what? And I'll agree with that. Just because
Okay,
he's
then.
so damn good looking.
Yeah.
Yeah. I
Mad props to Tremondae.
props.
Thank
Mad
you.
props, right? But why would you say that, Beeb man? Why?
Why would I say what?
Just because
Why would I say what?
He only said to you. He was
Never mind. We'll
gonna
move
say it
on.
to you too,
Fine,
but you didn't
fine,
get there.
Fine. I got you
I
back.
said it
Tremondae,
to
don't
you,
worry.
and yeah, I'm sure you got his back. You want to have his back, but you're not going to get it. Hi-yo!
He wants the back. Hi-yo.
Okay.
So, do you know what I was most scared of?
No, but I
They
was
told
trying
me-
to make a point.
Okay, go ahead.
The point I was making, Ron's, when I said I don't know how much you guys know about the female anatomy, is that most females don't know anything about the female anatomy.
Right.
There's a lot that don't.
Right.
Like, I had to put a catheter, a
Yeah, just
urinary
most. That's
catheter
what most
into a
does.
person,
That's what most means.
a
Swan.
female.
Most. That's
When
what most
as
means.
as a nurse, yes, I
That's what
got
it-
it,
that's
and
what it
she
means.
didn't know that she had 3 holes. I had to explain to her where I was going to put the catheter, the urinary catheter, in her urethra, aka into her bladder, and she didn't know. She had already had children, that she had 3 holes. And then it was funny because I explained it to her, and then I hear her talking to her children. She's like, I have 3 holes. I'm pretty special. I have a urethra, a Virginia, and she called it a Virginia. It was her vagina, and a poo
So
hole.
you have an
And I was like,
so
oh
you have
boy.
an urethra,
His name was Dwight.
which is okay.
Yeah.
Dwight.
Yeah.
Jeez.
So, but yes, there's lots of females or males or whatever people in general
Well, case
that
in
don't
point,
understand their own
what
body.
did my little brother say to you the other day that some woman said to him?
That she thought that if you had sex, you could pee out semen. Like if the condom broke during sex, that you could just pee it out.
Well,
Number one, it doesn't go to that same spot.
well, 9 months later, you'll find out if that's a fact or not. Now, won't you?
Maybe it's really hard to make a baby. So, but
You made one.
anyway.
Yet the dumb folk
Yeah,
are
I
really,
know.
really
I know what's
doing
up
it.
with my body. But anyway,
Yeah, so it wasn't me making an asshole comment. It was because most people
no,
don't
no, it
understand
was.
anything about. No, it wasn't. It's. Yeah, I've been doing this for a long time. Trust me. Most women don't understand anything about female anatomy. Case in
that
point.
sounds
All
like
right,
a-
let me ask you. Let me ask you.
All right.
Then to describe for me the parts that the Swan would have had removed. Should she have had a hysterectomy?
Well, first of all, I'm not a doctor, so I won't know.
But you just
but
you just said you know about the anatomy, the female anatomy. So if she had,
I play around with it on occasion.
you play around with your wife's uterus.
I don't think you've ever touched her uterus.
I don't think you've ever touched the cervix.
There it is, baby.
Hi-yo.
Oh, this is definitely not one of those podcasts. Okay, cool.
You may not hit bottom, Rons, but you
That's
probably
what
also
she
don't.
said.
You also probably don't beat the hell out of the sides. Hi-yo!
I think You had the Swan just go for the surgery so you could just go, hello, towards me. I really do.
Probably. Oh yeah, I just wanted to donate my uterus
Mhm.
for your
Yes,
enjoyment,
just so
Ron.
you know.
I think that's fantastic.
Just so you know.
And I appreciate that level of commitment. So anyway, continue, B-Man.
So when
Wait, don't you want to know what I was? Okay, go ahead.
No, go ahead. What were you
Go
going to say?
ahead. What I was most scared of before dying was right up there,
Pooper
but I
check.
figured I was pretty healthy and in good shape.
A pooper
What?
check? You thought they were going to check the ring?
No.
You want to see if the ring fits?
The pooper's all good. Pooper's all good. No, that
You know,
they
that
told me
actually
that
is
they were
part
going.
of the standard public exam. Just most people don't do it.
It is, and they write in your notes they either did it or they put deferred, but a lot of times they don't even ask to do it. So anyway,
It is part of the public.
but yeah. So anyway, when he was doing my pre-op visit, he was like, "Yeah, and anesthesia is going to do this really cool procedure before your surgery. It's called a tap block. So it really helps with post-op pain." And I'm like, "Okay, what is that?" He's like, "Oh, he just puts like some needles into your abdomen and numbs up your muscles the space between your muscles so that your nerves and your incision don't hurt." I'm like, "That means they poke me with needles while I'm awake." He's like, yeah." I'm like, "Yeah, that doesn't sound like fun at all. Poke me in the abdomen with needles while I'm awake. Not fun, not cool."
Sounds like
Dude, I
acupuncture.
want to be with a big ass needle, big needle, long, big needle. Ooh, yeah, while I'm awake.
Fascinating.
No, thank you.
No, they do.
That was the freaky part because I don't. You can put me to sleep and then you can do whatever you want to me because I don't want to know about it. Like I don't want not whatever you want, but you know what's supposed to be done needs to be done. But yeah, I don't want to see any part of my surgical suite. Like knock me the fuck out before we get there. Which my anesthesiologist was awesome. He did exactly that. I don't remember shit, even though apparently I had a conversation with him about it. So cool.
Mhm.
Anyway, carry on.
Yes. So if a woman,
I love the title of this podcast, by the way.
if a woman tells
Oh,
you
a
she
baby.
had a hysterectomy, that doesn't mean that she necessarily had everything removed. A hysterectomy just means removal of the uterus and the cervix. So sometimes this is my case in point why people don't understand anything about their anatomy. When someone says they had a hysterectomy, I always ask them, I'm like, so did you have just a hysterectomy or did you have a salpingectomy or an oophorectomy or did you just have the hysterectomy? And sometimes they'll just remove the uterus and leave the cervix and the ovaries and the tubes. So when I ask people and they're like, oh no, I had a total one. And then you look at their note and like, no, you still have your ovaries and all this other stuff. So hysterectomy doesn't mean everything's removed. There's actual additional little terms that they say.
But that's what everybody thinks, I think,
Yeah.
when you say that.
So does this mean that if you have a hysterectomy, you can have unprotected sex?
Oh, that's
No,
a good
Well, you
question.
shouldn't have
shouldn't have
unprotected
unprotected sex.
sex
Well-
anyway. It means you can't get pregnant because you don't have a uterus anymore.
More to
I
Tromondae's
don't
question.
have a uterus,
I think that's
and
where
I
he was
don't
going.
have fallopian tubes anymore.
So,
But I have my ovaries.
so going back to what Tromondae said is, I think what he meant was, you can now have sex without birth control.
Yeah.
Sure,
If you're
yes.
in a committed
That's a good
relationship
question.
and you don't have to worry about
Yeah.
STDs or STIs. Yes.
Yeah. Well,
Well said, Rob.
thank you. I get one occasionally. Yay, thank you. And the Swan is in a committed relationship.
Swan couldn't have made a baby prior to this. So
No, I said you were in a committed relationship, and the
All right,
B-Man
let me
did
get to
not
it. It's
answer back.
43 minutes. 43 minutes in.
Okay.
Let me
Wait, Tremonti wanted to tell the title of this podcast anyway. He likes it.
Oh,
You have to say it like it's,
it's not a baby. It's a tumor.
Oh, I thought you were going to do the...
I was thinking of more the Arnold
Yeah.
Schwarzenegger.
Oh, I'm not good at that's the beat, man.
Get to the chopper. I can't do that.
Not a
That's not me.
baby. It's a tumor.
Anyway,
Okay. Go ahead, BJ.
Go.
All right, so
come on.
I'm just going to get right to the incision. Incision was carried through the subcutaneous tissue to the fascial layer that was then nicked in
This
the
is like a
midline.
bedtime story. It's like a bedtime story. Swan surgery. Bedtime story.
So you didn't
Banjo.
translate that at all. You just started fucking talking with your big fat mouth.
Yeah, you like it. Okay, go ahead.
I already said it.
Do it again. Start it again. Do it again. I want to start over
I
again.
said the
Start
incision
again.
was carried through the subcutaneous tissue to the fascial layer that was then nicked in the midline.
So basically, stab you with a knife, cut across the middle. Stab in the middle, cut across. That's what I
Through the fatty
going with.
tissue
They
down
mar-
to the
They
fascia
put
layer.
markers. They put marker on my belly too. I think it's so they could line it all back up nice. Hopefully, through the fatty tissue to the muscle. Said I was fat.
To the fascia. The incision was then extended
Fascia.
laterally with male scissors. Big deal. Clamps were applied to the superior edge of the fascia that was dissected from the rectus sheath. That does not mean your butt, Ron's.
It means my abdominal sheath that they told me that I need to be really, really careful not to cause problems with, and don't overdo it because it can separate, and then you have a big old belly hanging out with your separated abdomen.
The rectus
after
sheath using
surgery.
both manual
All that.
resection and the mesial scissors. The same procedure was performed at the inferior edge of the fascia.
They stretched that shit open real wide so that they could birth.
Yes. And
my
then here's
tumors.
one of my favorite parts. The muscle was then separated with the fingers.
Yeah, isn't that gross? Like they just stick their fingers in there and spread that shit all apart. I'm asleep now, by the way, thankfully.
The
with lots of drugs.
peritoneum was then grasped with a hemostat and was entered with Metzenbaum scissors. So
Some fancy terms for
you
some.
have
I
wrapping.
need to use a whole bunch of tools in there.
Yeah, you're gonna explain what the
Okay, go ahead.
peritoneum is, there, genius?
Go ahead.
No,
The
you just want to talk
the
about it.
outer layer wrapping around my uterus.
We are separated into cavities. This is the abdominal peritoneum.
Like
which is
all
the
your
covering.
guts don't intermingle and commingle with each other. They have layers.
Anyway, this is the outer covering of the peritoneum, the abdominal cavity. So the peritoneum was grasped with a hemostat and was entered with Metzenbaum
I feel like
scissors.
that's if
Shut the
your
fuck
appendix.
up!
Wait. If your appendix ruptured and you get peritonitis, it would be full of fluid and
46
infection in
minutes.
there, right?
46 minutes.
You wanted me to interrupt and interject, so I'm
No,
doing
I want
it.
you to interject on stupid shit. Yeah, I feel like if you had appendicitis and it ruptured,
Hey,
that'd
why
be
don't you
inside the
go fuck
These
peritoneal
are
cavity.
probably the two
And then-
worst people you want doing your surgery.
I don't
So-
do surgery. I already explained that to you.
But you
See,
could.
yeah,
could if you wanted
if you-
to.
No, I
you know,
couldn't. No, I
Even
couldn't.
in a
What
last
surgery could I
ditch
do?
effort, you get
If
a
someone
bullet wound,
trained
they're
you,
going to
you could do
argue
brain surgery.
what's right and what's wrong.
Hey, you know what? We worked very well together, didn't we? Kick some ass.
Yeah.
Yeah. Anyway,
So is the bead man allowed in
Hey,
the
carry
surgical
on.
room?
No.
no.
Why would I be allowed in the
No,
surgical room?
They wouldn't let him in, even if he wanted to observe from a medical
Why would I
standpoint.
be allowed in
Because
the surgical
that wouldn't be. It's not like I'm having a fucking C-section. I mean, that would be the exception to the rule if you're having like a baby.
And probably not even
then-
during COVID. Who knows?
Yeah.
All right. Can I get on with it? Can I get on with it now? Is that okay?
Yes. Carry on.
Okay. Well, anyway, the uterus was visualized, and the large fundal fibroid noted, as well as anterior fibroid noted.
So they thought I only had one. They open it up there and out pops two twins. Yeah. Fundal, aka the one on the top.
The
And
plot deepens.
it does. Twins. Not just one.
The bilateral tubes and ovaries appeared normal. The Swan did not.
Yay. This one. Yeah.
Now it gets good. The uterus was grabbed with cokers. I don't know if this is the right term. Sometimes they dictate
Coconuts?
this stuff, so I don't even know if this is the right terms or not because I'm not a surgical person. On each
Kosher,
side
I think.
and delivered through the incision. So the uterus
Delivered like birthed.
birthed. They just squeezed her sides and birthed.
Like a pimple. Like,
uterus.
pop that shit out.
The fundal
I feel
fibroid
like-
was grasped with a penetrating towel clamp and injected with pitricin, diluted in sterile saline. So they just pulled it out and they.
Stabbed it with some medicine. I feel like they're trying to kill it.
This was then
I feel like
inside.
it's to stop bleeding. What is petricin? Does it stop
I don't
bleeding?
fuck-
I'm thinking it's something that stops bleeding.
Yeah,
You
it's
said
probably
they bleed a lot.
pitricin. It's probably pitricin. Pitricin.
Yeah.
This was then incised with the bovie.
Which is a freaking hot knife, electric knife that they just cut your guts out with.
And this is one of my favorite parts. It was then shelled out bluntly, and they just folded it in.
Like with like a ice cream scoop, like a pumpkin. They just pumpkin scooped
They
me.
shelled it. They shelled it out bluntly. And it was then passed off the field.
Like catch.
Placed like
Like
a
a
baby.
football.
Like a baby.
Like a baby.
Is this
Not
video?
just bored.
No,
I'm just
I'm
bored.
actually.
No, they should have took a video. That would have been cool.
I was
But
gonna
no,
say,
I have
this
a
is
picture
like-
of it.
The area was then clamped together with a
Interesting.
penetrating
It is,
towel
it is.
clamp to provide hemostasis. And
So I
attention
don't bleed all over the fucking place.
attention was then turned to the anterior fibroid, and the same procedure
It's
was carried
twin.
out.
They couldn't even write about that guy. They just said, and the same procedure. They didn't give him the added satisfaction of giving him his own shelled out, scooped.
It's getting better.
You know, and I didn't know because you didn't do surgery. You said when they use the Bovie, they put this patch of stuff on you. They freaking ground you so they don't burn you.
Yeah, you ground you so that you don't
That's
get shocked, yeah.
crazy. So you don't get electrocuted. They could have electrocuted me for God's
No.
sakes.
The current would have passed right into the ground.
How would that have happened?
As someone who knows what they're talking about with grounding and bonding, if you've got
Because
a
he's
ground-
assisted on exposed wires, down power lines. He had rubber boots on.
Then why would they need to put the grounding pad on my leg then?
Do you know
Just
how
because?
you know how to static charge is discharged from the body?
Mhm.
Sure, like when you touch
Exactly.
the wall and you shock
And
yourself.
what that does is it
Mhm.
travels down to earth. Now to ground you, that's what they're doing. Basically, they're grounding you out so you don't build up a static charge.
Yeah, and fucking electrocute myself,
Right, that's the
burn me. That's the point.
that's the
That's what
point.
I
That's
said.
why we're not allowed to touch people when we shock them, because we'll get
Because
shocked.
you get shocked
because
also.
we're conductors.
I mean, Tromondae did the Tough Mudder. Did you get shocked?
Yes.
Did it
Yeah,
pass to the
that
earth
shit
and then
hurts.
didn't bother you at all?
Or did it hurt like a bitch?
Oh, it hurt. It knocked me
Okay,
down a
then.
couple
Why
of
did
times.
he get
Yeah,
shocked?
see? Because that's the final thing. You walk
This is-
through
this is
the
what you look like,
electrified
Ron.
wires. You're like, "Ee!" It left bruises on my, like you got punched in the leg from it.
No,
So yeah,
I've
Somebody went through it and they shouldn't have.
somebody who has a metal plate in their ankle. Yeah,
That shit
was
knocked
not
me
a
out
good
like
idea.
that. Felt like I got hit in the leg with a baseball bat. The funny part of that
So-
was that as I was in the water, instead of helping me, freaking Nick just ran right over the top of me. Literally stepped
Yes, he did.
stepped right the fuck on me.
So let me get this straight. In the Tough Mudder, there's an actual point where you go and get electrocuted.
No, you don't get
Yes, the
electrocuted.
last-
First of all, it's not. No, you do not get electrocuted.
Not electrocuted. They have electrical wires hanging down that give intermittent zaps, and it's a lot of voltage. Like it's enough to knock you
Mhm.
down.
It's a lot of wires.
Anyway.
Wow. Okay.
You're gonna get.
Yeah.
Ken made it all the way through the first time we did it
Without
He
getting
didn't get
shocked.
shocked once. He made it all
Yeah.
the way through.
All right.
He
That's
lucked out.
cool.
Anyway,
Anyway,
Carry on.
so then let's see. Bladder flap was created. The same procedure was performed on the other side. Then the broad ligament was transected and a Heaney clamp put across the utero, ovarian, and fallopian tube on the right side.
So now they're like clamping off my shit so my stuff doesn't bleed all over the place.
Mm-hmm. Pedicle was cut
take
and
my
tied with
tubes out.
zero vicryl, and the same procedure was performed on the other side. So this is why I say a lot of people don't understand anatomy. A lot of people think that the ovaries are attached to the fallopian tubes, but they're not.
But they don't. They just kind
They're
of
not
hang there.
attached. They're sit below the fallopian tubes, or the fimbriae. What they're attached by is ligaments to the uterus, which is your round ligament. So again, do most people know that? Probably not. It's just connective tissue.
So very well.
So if you
So
remove
they
the
took-
uterus, it's not you can remove that and still leave the ovaries in place just by nicking the ligaments. So now, once you take that, scoop all that portion out, you've birthed two babies, you've birthed the uterus. Now you've got this giant gaping hole because the uterus, obviously, and you know this, Ron's from female anatomy,
Because he knows anatomy.
the most distal portion of the uterus, that which you've never tapped with your penis, Ron's, is the cervix.
Where the baby comes
So
out.
that drops down into the superior portion of the vagina or the vaginal orifice. And so once you take that out, now what do you have?
A big gaping hole that your guts would fall through if you didn't do
I
something.
love
with
how
it.
the Swan is
Or-
playing the hype person here. The B-Man states it.
Because it's my body. I mean, I thought about that after I'm like, what
I
do
was
they
trying
do?
to get
'Cause
them
they're
to
gonna
say that.
take out-
I was trying to get them to say that, Swan, but you are answering the question. So what I'm
Sorry,
trying to
I'll
say
just be
is
quiet over
there is
here.
now a big hole between the opening of her vagina and where her uterus and cervix were.
Hmm.
So they got to sew that shut.
They're gonna sew my vagina shut.
Well, the B-man's not
You're
using
not
it
sewing your
anyway.
vagina. Not sewing your vagina
Well,
shut.
technically, they are showing my vagina shut. Just the very top inside portion of it. They're making a spot where the cervix was a closed hole.
Well, if it's
Right?
closed, it's not a hole.
Well, they're closing the hole.
They're
How about
closing the
that?
hole. Yes, yes. They're
Closing
closing
the
the
hole.
hole. Closing the
So my
hole.
guts don't fall out.
So, Tromondae, what do you
Yeah.
think of all this so far?
I really would like to see like what it looked like when they were actually like performing the surgery, like to hear how things like split, and like I would love to see
You want to
like
hear the
actual
sounds of
size
surgery? Oh, you want to see the size? Okay, I wish I would have emailed it so that I could put it on a screen share, but I'm just going to have to share the picture so you guys can see it. But, okay, let's see if I can find it.
So anyway, then they sewed her shut
Turn it.
and done.
Then,
Sewed her shut, and
Yeah.
that portion that is now sewed shut at the top of
oh,
the.
this isn't going to work.
Why
I'm
didn't
going
you
to have
just
to
text
text
it,
it to
Can
you
you
guys.
text
moron?
it to us?
Shut up.
It's called the vaginal cuff. If I could just finish that part. It's the vaginal cuff.
Yeah, the vaginal cup.
Which
Now I
if
have a vaginal cup.
which if Ron's wife had a hysterectomy, he also wouldn't tap the vaginal cuff. He wouldn't reach there either.
I'm a little scared about that, actually. Like, that next time after I'm cleared to do that stuff, I'm a little scared about what's going on in there. It's coming to you guys in text message.
So what
So
you're going to do there is
that's what I was
coming to
gonna
them in a
ask.
text message.
Yeah. We're going to video it. No, Ron's probably be all about that.
So I was going to ask, like you say you can have it either a C-section or you can have it through the vaginal canal.
Or laparoscopic, like they can take it through these poke holes and pull it out. Like,
Well, if they
crane game.
if they did it vaginally, they'd still have to do a laparoscopically. They'd still have to do a laparoscopic
Yeah, they do the
holes
poke.
to put the instruments and the camera in. I'm assuming.
I don't know, because
Would
he said
that-
it was 3 different ways. Like, it could come out just vaginally. So,
Interesting.
Would that like
maybe that
change
is
a
if
woman's
it's
sensation
inside of the
down
uterus,
there?
like if the fibroid was in the uterus, they just dilate it like you have a baby, pull it out that way,
Yeah, and then just transect it and then
and
sew
then
it
just
shut from
yes.
sew it shut from the inside instead of from the superior portion, so the inferior area. So okay, on the other
Yeah.
side. Interesting.
Yeah.
Wow, that's the
Fascinating.
size of a pen.
So would it change sex? I mean, probably not any more than having a baby, because your cervix dilates and goes away for the baby to come out, and then closes back closed.
So
So did you get the
I
picture?
did. It looks interesting.
So on the left are my 2 fibroids,
Okay.
and the pen showing you the marker is the size.
Wow.
so
Yeah,
you
I
can
see that. That's pretty
And
interesting.
then that uterus, the bottom part, the cervix part, is at the top of the picture. So the uterus is upside down in that picture. Tromondae's face looks pretty gross. You want to eat some meat tonight?
No, I'm eating pizzas.
Cheez-Its, those are good for you. But yeah, it's pretty. I think it's kind of gross, but yet kind of interesting. I just don't understand how all that fit inside of me, like that. And I just want to let you know they didn't weigh it, but I lost 6 pounds.
Wow.
So that's a lot of
That's
freaking.
a lot of.
Wow.
So,
Okay.
how do you feel now?
How do I feel now? Honestly, I feel a lot better than I thought I would feel. I thought it was going to be a lot of pain and a lot of like I don't know. I thought it was going to be a lot more uncomfortable and a lot more painful, but I feel like I'm doing pretty damn good. Like the first day kind of sucked. After surgery, I felt nauseous and dizzy and all that fun stuff, and I didn't want pain medicine, but they gave it to me anyway. And then we were supposed to go to my room, but that didn't happen because my room got flooded. So they had to give me a different
What, did the
room, and I
bidet
had to sit in the
back up or
hallway
something?
for it. Probably. No, the ceiling. Somebody overflowed the shower from the room above my room. So then they had to wait for a different room, and I was in the hallway for what felt like an hour. I don't know how long it really was, but it seemed like a long time because I was in pain and I asked for pain medicine, but they wouldn't give it to me because I hadn't seen a nurse yet. So
Did you say, but I am a nurse?
no, I did. I was keeping that on the down low.
I had a friend.
So, and then
Okay,
listen to
I'll
this
listen
one.
to this.
So they took me to my new room, And they're like, do you want us to slide you over from the bed to the other bed? Which to me in my head says, ooh, that's going to hurt like a bitch because I'm already hurting and they're going to slide me over on a sheet. Nope, I'd rather stand up and walk. Well, instead of putting the bed right by the other bed, they parked the bed outside the door,
Which is what we used to
made
do.
me walk. And I was like, well, huh?
That's what we used to do. Put the bed right next to the bed.
Yeah, that's what I figured they would do. Bring the bed into the room, let me stand up, turn around and sit down. But no, they parked the bed outside the door from the room. So I had a whole, probably 10 feet.
More
I
than
don't
that.
know, 10 more than, I don't know. It seemed like a long way walk from the bed to the bed. But so I was like, well, while I'm going, might as well go to the bathroom. Went to the bathroom. Big old gush of blood comes out because that's pretty normal afterwards. I'm sitting there. All of a sudden, I don't feel good because I get dizzy and sweaty and clammy. I'm like, I'm going to pass out. Need to sit down right now. So I have nurses and somebody there. But who helps me to the bed? The beef man, because dumb bimbo nurse is trying to take my blood pressure. And I'm like, I'm going to pass out right now. I need to like sit down. I need to lay down now. And she wants to put a sheet on the bed or a blue pad on the bed so I don't get blood on the bed. I'm like, if I wasn't there, if he wasn't there to help me, I would have passed out on the toilet. Then you're going to have to fucking clean up blood and me on the toilet. That's a dumb idea. Like, I'm telling you, I'm going to pass out. I don't feel good. I'm dizzy. Checks my blood pressure and it's 80/40. That's low, folks. And my heart rate is 90.
Yeah.
But she didn't think that was a problem.
Well, no, because she's like, it's okay though because your heart rate's 90. I said, yeah, except her normal heart rate is like 54.
50.
So she's so she was about to pass out.
So back to my earlier question, which means at the pre-op, if I'm getting the term right, was okay. The operation went okay. It's the post-op, as it's
I
called,
don't like the facility.
That sucked.
I hate that facility.
I hate staying in the hospital.
It rhymes with Johnson, and I hate it. But that's where her doctor goes.
Yeah.
Mm-hmm.
So I feel like, yeah, I had to be my own nurse. No. She wanted to give me more pain medicine after that. I'm like, dude, my blood pressure is 80/40. I don't want any more pain medicine.
When you said that,
I feel like crap.
When you said that, did they look at you like you don't know anything? Because you didn't reveal that you were a nurse.
You have
so you know about blood pressure probably from some medical show or Dr. Phil, they're assuming, right?
And then she never checked my blood pressure again. Get that?
So I think the worst case scenario is with people walking in thinking that they found the cure or whatever they know on WebMD, right? Versus the real medical people like you and the Beeve Man knowing what the hell's going on. So they probably blew you off because of that, which was wrong in my opinion, by the way. They should have never blown anybody off. But it's obviously that when you was talking about, hey, this is what my blood pressure is at, they should have actually started to take you a little bit more serious, right?
There wasn't any point. There wasn't any point in time where they didn't do something that I had to say something about. In other words,
exactly.
It was all under control. So I'm not going to make somebody feel stupid if I've got it under control. If they had started to do something, if they had done something stupid, then I would have had to bust out the asshole know-it-all portion of myself.
Yeah, if he wasn't there, I would have passed out because they would have kept me on the toilet, checking my blood pressure and all that. I got myself up and moved to the bed because I was like, if I continue to sit here, I'm going to pass out. Like you can tell when your body is going to do that. I mean, thank God I had enough warning, but I'm like, I need to lay down now because lay down makes my blood pressure get back and my heart rate go back to normal.
So kudos to the B-Man for not becoming a raging asshole and a know-it-all.
He did really good.
He's a know-it-all.
I mean, I was on drugs and he did really well.
But do you think that was appropriate to tell us that you're on drugs right about now?
Yeah, because it's relevant to why I felt like shit.
It was this was relevant.
Yeah, this was relevant because
this is the difference.
It is the reason why I felt like shit. It makes people who don't take those medicines, they gave me freaking fentanyl and Oxycontin. Like, I don't take anything. I take Tylenol, ibuprofen. If you don't take those medicines, I felt drunk, hungover, dizzy, and lightheaded all at the same time.
And she wasn't even remotely interesting.
No. I'm coherent. I was not funny or whatever. It was completely, I was being nurse. I'm like, I feel like shit. I was completely lucid, having a normal conversation, but just felt like crap.
So
And then she wanted to give me more nausea medicine, which also makes you feel loopy and like crap. I'm like, I don't want any more medicine. I'll just lay here and be nauseous. I'm gonna try really hard not to throw up because that'll hurt like a bitch.
So would that have made her more interesting, though?
No.
What? No.
Okay.
Throwing up?
Because
No, you
even-
definitely don't want to throw up with an abdominal surgery.
No. Nope. I swallowed that urge to puke, like that juicy, acidic, back of your throat puke taste, pre-puke taste that you get. I swallowed it like a lot of times because I was like, ooh, I do not want to throw up. That's going to hurt so bad.
It would have been nice to like come out with one of those videos where like a woman just comes out of surgery and there's this guy walking beside her and she's like, "Who is this handsome
Oh
guy?"
yeah,
And then
yeah,
finds out,
yeah.
like it's her husband. She's like, "I'm married to you. I don't deserve you. You're so handsome and you're a knight and all
But
these
it would have
other
been
things."
funnier. It's like, is your name Tromondae?
Ron.
No, I don't get those videos. I think, I don't know, maybe people really do get like that, but that doesn't happen to me. I act completely normal. They didn't even think I was stoned when they were giving me my medicine to do my procedure, my
She was.
poking of the abdomen procedure.
She
but
was
I
talking about
was,
this
but
fast. Hey,
no, why wasn't?
Yes,
I think
you
the
were.
most scariest thing I've heard when somebody comes out of surgery and they're in the recovery is when they're screaming. Right? They're coming out of that anesthesia coma.
That happens to a lot of
Yeah,
people. Like they wake up badly or they have like bad nightmares.
I
I
or
don't
happened to me
think.
when I came
whatever.
out.
I heard screams when Carrie was in for surgery. I got to go into the recovery room when
They had
told
him
me I could
scrub
go
in. He was like all scrubbed in.
Who's helping?
They'd heard about
They're
his
like, hold
prowess.
this.
They'd heard about his prowess with the down power line. So like, okay, let's scrub this guy
Like, he's
in
an
because
expert at the
we
bogey.
No.
might need his help.
No, I didn't have to. I didn't have to scrub in, but they're saying, I walked in, and I heard people screaming or a person screaming, and I'm like, "What's going on?" Oh,
That's because you were wearing a gown that was open in the back, and they're like, "Sir, those are our patients."
No, that's the thing. I was just a bit taken about it. I remember when I went in for my surgery, I woke up there. It was a bit surreal. So
They had to jump on me when I woke up out of mine. They had to.
He's trying to get up and rip things off.
Yeah, I did because it was after I had my surgery on my neck, and I was in the recovery, and I thought I was on. I thought I'd been abducted by aliens. I thought I was on a spaceship, and because I
Wow.
couldn't move right, I had this what we call a turtle shell. So I had this shell on my chest and on my back, and then I had this apparatus that came off of it that held my neck in place, and I couldn't move. And of course, I'm blind. Before I had my surgery on my eyes, I'm blind basically if I don't wear glasses. So of course I didn't have glasses. When I woke up, everything was blurry and it was all white and it was cold, and I had this weight on my chest and I couldn't move. So I started thrashing, pulling my stuff off, and they had to hop on me. And they're like, "John, Beef Man, don't you remember where you are? Don't you remember what happened?" And I was like, it took me a couple minutes, and I was like, "Oh, okay, yeah, sorry." But I thought that's what happened. I thought I was
Right.
abducted by aliens.
Okay.
Yeah. I think I kind of like just moan when I wake up from surgery. Like, that's right. Wasn't that what I was doing? I just remember like,
Yeah, her face
Wait,
was all scrunchy. Looked like she sucked on a lemon for a while. And
Like-
when I got back there, her nurse kept asking her, she's like, he's like, "Do you want anything for pain?" She's like, "No." She's like, "No, I just have cramps." And she just kept moaning and her face was all squished up. And I was like, "Are you sure you don't want anything for pain?" She's like, "Nope." And I looked at the nurse and he looked at me and I was like, her face looks like, he's like, "Yeah, it looks like she's in pain."
But I'm anti-pain meds, man.
You know what was?
Like, no.
I'm like, "No, that's what her face usually looks like."
I guess I've had good experience in the medical field because Carrie had the best.
Because you don't know any different.
No, that's not true. You're right about that.
That's
no,
true.
No, I'll agree with you on that. But behind the scenes, we've had some really good people, and I'll tell you how. When Carrie thought she was having a heart attack, right? It was actually GERD. You know who came in and saw her from cardio? McKaylin, right? Now you know that name, Beav Man.
Yeah, she knows nothing. Why would she come in and see her?
But she came in and supported Carrie. And
so you like
See?
all of a sudden like
Very
somebody with no freaking medical
no medical
knowledge
degree at all.
whatsoever comes in.
Don't
Like,
come
I do
down.
EKGs for my job.
But who else took care of her? Who was in the medical was Carol, right? And you know that name too.
Also not a
Social
No,
worker.
she was. I forgot what
you're like two people that like that's not direct medical care people like just somebody who came in who had no medical training whatsoever
Housekeeping.
who
No,
does
no.
They were really cool.
Carol-
My housekeeper was
Carol
cool.
came
His name
in-
was
Carol
John.
came in and took
someone who's a
vitals.
social worker.
No,
someone who's a
Carol
social
came in
worker.
and took vitals, right? Hold on.
She was a nurse PCA at the time.
I think she
maybe.
was, but she was right there. So we had some really good support there, right? And I think that was the case. That makes the transition a little bit better when you walk in. Yeah, you're scared out of your skull. You don't know what's going on, but if you've got a good support staff,
So you had the comfort of people you knew coming in, and that
and
made
who
you feel
leveled the
comfortable.
playing field. If I had a question, you guys know the BS answers. They're going to feed me a BS answer, right? Or they're going to tell me an answer
Right,
I
but if
don't
you had
understand and
questions
walk
to
away.
level the playing field, you were going to ask it to two people who have no medical knowledge. Hey guys, I have a question
I
about
think they
this.
had
I'm like,
Well, apparently,
yeah,
yes. That is leveled the playing field
I think they had more.
for two lay people.
They had more
I
medical
guess.
knowledge than I am, but I mean, honestly, they made the situation a lot better. It really was.
well, that's good.
right?
I'm glad. I'm happy for you. As long as you don't call me, I don't care.
Harsh.
Now, if we do call,
No,
you,
that's
can
the
we
new
call you
thing.
Mr.
That is the new
Beefman?
thing that the bee. That is the new thing that the beef man does. He will not give medical advice to anybody, family included.
Oh,
I will
Because nobody
I will to Tromondae,
listens.
but that's it.
Because Tromondae
Yeah,
listens and
I
is a
listens.
good patient.
Wait a
No,
minute.
I've actually
And you call and ask, and you
recently within the past few weeks, I have been contacted on Facebook Messenger, and my medical opinion was asked, and I said I don't give medical advice anymore. Sorry.
well,
You're gonna have
that's
to make an
that's
appointment.
that's a
You're
good
going to have to make an
good
appointment.
way.
You're going to have to make an appointment with your doctor.
because those people want to validate that you're wrong, or they don't listen to what you say anyway. So why ask? I mean, at least the Tromondae, when he asks, he's asking because he genuinely wants.
Did
your
he ask
opinion
about the
and
poopies?
listen. Not yet,
No.
but he was going to.
Just because it's my poopies.
I think it's only
Well,
appropriate.
you've made it through an hour and 11 minutes without the poopies, so you're
And I think
doing
it's
good.
I think it's
I might
I think it's
do
okay
that
for me
much.
to talk with Tromondae about it because Tromondae actually was my patient, so I can actually
True
talk.
enough.
I do feel I can say something,
Really?
and I usually
That's where it all began.
direct him to the medically
Appropriate
places
places.
anyway. So, but anybody else wants to ask me?
Yes.
No, fuck no, I'm not telling you shit. Sorry, I don't do that anymore.
Yeah.
What if they came to you a question about being a martial arts practitioner? Would you give advice then?
No, I would direct them to you.
Oh, you
Well-
as JoJo representative.
Hmm.
Yes.
What about Fiore?
Well, it's
You give him the class schedule
it's actually
and description.
knocked down. I'm
description.
sorry. No, I would say if you want to come check it out, come check it out.
Ah, okay. So, any army stuff though that we could go to you and you could answer.
Only if you're talking about decades ago. I can't really speak to what happens now. They don't even have the same vehicles or all the same weapons anymore. So I could talk to you about the old days, but that's about it.
Cool.
I pretty much don't want to give anybody advice about anything other than not to annoy me.
Because nobody wants it,
No,
right? Didn't we have this
exactly.
discussion? Nobody
Swan
wants
doesn't
advice.
want
They
advice.
just want you to they either want you to agree with them so you can join their bitch fest with them on their team, or they're gonna argue with you why you're wrong.
Or they want you to do nothing.
Or they just want you to listen so they can feel validated. So
And what would validate the B-man to getting a question answered?
I don't do that.
So the one.
So if you want the answer to a question, what do you do?
If I want to
Yeah,
answer
I
to
mean,
a
how do
question,
we-
what question would I ask? What question do I have? What do I have questions about?
I don't know.
Any questions I have I discuss with people who are doing the same thing I'm doing or have the same opinion as me. So it's really, is it a question? It's not a question. It's a discussion. So
So you're telling everybody to find like-minded
historical
people.
European martial arts. If I have a question about that, it's not actually a question. It's a discussion between me and the people that I do it with.
But it invokes questions. So if it invokes a question,
it
are you
stimulates
going to answer
a discussion. It stimulates a discussion. No, because it's not a living martial art, so therefore it's all discussion.
Wow, this is just surreal. I
It is
pulled
the
this question
practice.
out.
It is the practice of necromancy.
I pulled this question out, and the question was, what is the single best piece of advice you've ever received? And I would say the way the Beeman tells everybody to shut the fuck up.
I think that that's a good piece of advice.
Uh,
I can actually answer that question though, if you want to hear it.
Oh, please do.
okay, what is your answer?
I do.
All right.
I do.
You can't teach what you don't know. You can't lead where you won't go.
Mm.
You can't be what you are not, and you can't give what you ain't got.
Was this a Dr. Seuss novel?
No.
That was well said.
Yeah. So where did you hear that
It's-
from?
That was the best advice I've ever had that was given to a group of us when I was in the primary leadership and development course by our course instructor. That was the little phrase that he lived by. And
Did he make it up himself?
I
or
don't
did
think
he
so. I
just-
think he got it from, I think somebody else told it to him. And he
Was
passed
that-
it down to us.
You say primary course. What is that? Army or
Primary
medical?
leadership, Army primary leadership and development course. It is the course you have to take to become a Sergeant E5 in the Army.
Okay, understood. No.
So there you go. That's the best advice that I've ever had given to me. Knock, knock.
Who's there?
Chata.
Well, I was hoping
Tata who?
I was hoping somebody else would jump in, but
Shut the fuck up.
okay. What about you, Tromondae? What's the best piece of advice you've ever gotten?
He's gotten correct.
I didn't know we were going to go around and share.
Well, there's this dead silence, and the Beeman does not like silence.
So, best advice I've ever gotten. My father told me there are two things that you don't buy cheap. You don't buy cheap bread, and you don't buy cheap tissue because your finger can go through both of them.
And that
Nice.
especially comes through
That
this
is true.
week, right?
This is totally relevant
totally
to the
true.
poopies.
Totally
Yes.
relevant.
Your father is a wise man.
I'm totally with him on the toilet paper situation.
Yes.
Definitely.
The
How about you,
subject matter.
Rons? That's just yours. That's all you have to say is just the B-man telling people not to give a fuck and tell them to shut the fuck up. That's your best
No,
one?
I think the best piece of advice.
But maybe that is, he just took your advice. Maybe he's standing up for
It is
himself
good
now.
advice. It is good advice.
I've
is.
gotten several pieces.
You know what
of
else is good advice?
Good advice.
Strike
What's that?
first, strike hard, no mercy.
Yeah, definitely.
Yeah.
Yeah,
Cobra
it's
Kai.
like
Precept.
Cobra Kai. I think I'm still getting really good advice from various sources, right? I never stop getting advice, and that's the thing. What's the best piece? I think it's when my wife said "I do," which is really great.
That's
I
advice.
think the best piece of advice.
How's that advice?
Yeah, because because you don't know how it's ever going to turn out in marriage. Hopefully, it turns out for the great, right? But the best advice I've gotten from you was, "Hey, you're doing great on the podcast, but this is how you're going to do better. Shut the fuck up."
Right?
Right?
Is that advice?
Yeah.
Well,
Well,
okay then. So
No,
what have
no,
you
I
learned
think-
today?
No, I think the
What
best
have you
piece of
learned today,
advice
Swan?
is always do better than yesterday.
Oh,
What did I learn
yeah,
today?
what did you learn today?
It's okay to be a layperson and go to the hospital
Is
because
it?
you'll have your friends there.
According to Ron's.
Well, you guys come down on me, but I mean, if I asked, I think the B
As
man.
long as your friends are there, it's
Your
okay.
friends
I
are
asked the
there
beat
to
man.
who are equally lay people. It's fine.
I asked the B man, and it's like, do you want us there? Do you want us to show up? Do you want us to support you in any
You
sort
can't.
of way? And it's
Like,
no.
it was nice of you to say, but you're
Yeah,
like, you
you-
can't. But you can't.
Yeah,
that was
but,
nice of
you
you
know,
to say, but yes, you can't.
Yeah, but the
They only
thought is
allow
there.
2
If
visitors.
you've ever. Hmm? And who was the second one that saw you?
Baby Swan.
Baby Swan.
But we had to lie about
Baby
her
Swan
age.
came to see her. Yeah. They didn't say that you had to be a certain age.
No, they didn't say it till we showed up. Anyway.
Yeah, that she had to be 16.
And what did you learn today,
She's not
Tremonde?
16. Stay home when you have the poopies. Keep
You
your
already knew
poopies to
that.
yourself.
Oh, yeah.
Good job, Tromondae.
What did I learn today from our conversation or just
Just in general.
Period.
What'd you learn today,
Question
Tremonde?
everything.
Did you learn something about the uterus?
I really didn't get to talk about that much, but that's fine.
You can talk about
No.
it. Talk about it some
No,
more.
we're done. I
feel
was asking
like
you what he
I-
fucking learned today, so I'm wrapping shit up. So just be.
I learned that it's pretty damn amazing that all that shit could fit inside of me.
because she wasn't aware
Well,
that
you could
anything
be-
big could fit inside of her.
Oh,
I watch some
Yeah.
really cool smuggling shows. You'd be surprised what you could pack in a human body.
I mean, that is true, but where did that all fit?
I'm asking
That's
Tromondae
crazy.
what he learned.
Anyway, okay, Tromondae, what did you learn
today.
today?
Yeah, so I've always like thought of the body to be very
Disgusting.
intricate, and like today I just
Disgusting.
learned a little bit more about some of the specifics of what can occur within our body.
Yeah, it's pretty amazing. I don't know.
Yeah,
I mean, I
it
can grow
is.
a baby in there, and obviously some fibroids the size of a small baby
In your
as well.
baby bag.
In my baby bag. Yeah.
And what I
Get a
learned
little purse.
today is that the Rons has never hit the cervix. That's what I learned.
Hey,
You know,
Aw.
there's always hope, and
All
I
right.
think the best advice from you is keep trying.
Yes. keep
Try
trying, keep
again.
trying.
Oh,
Do
do
it
it again.
All right. Well, that's
Do
it
it
for me, the Beef Man. It was nice to have everyone together. Unfortunately, it was not in person because Tromondae has the poopies.
The
Or
poopies.
he's about
The
to have the
poopies.
poopies.
Yeah, maybe he
He's about
had
to
the
have the
poopies. Maybe he's all done
yeah,
with
I
the
think
poopies.
it should be okay.
That's okay then. All
Yeah,
right.
and you know what?
yeah,
The Beef
yeah.
Man gave
I'm
me
not
hell because
done.
I texted him, "Are we doing this remote or not?" He's like, "Did you not read the text?" And I said, "Well, things change up until the last second, and yes, you, Tromondae, have proven me right."
Way to go, Tromondae.
No, but at
You
the
proved
time when
him
you
right for
asked
once.
it wasn't
Yeah.
Yeah.
Right.
And considering you were the
don't back
last
out
one
of
to
this.
text
That's
and
the
confirm
best
it, but
advice.
that's fine. All right.
Just proves that everybody is nice and versatile.
Yes. Adios, mooch fuckos.
Yeah.
Bye from the Swan.
deuces.
Happy belated birthday to the Tromondae, by the way. I know it was your birthday last Monday, so.
Podcast over. Ron, say A. Now shut up.
Oh, way to go,
Say
Swan. Stepping in for the Beef Man. Now we know who wears the pants of the family.
Podcast over, Ron.
Hey, for the Rons.
End of podcast.